how can I help you move better? That's my main job. I just facilitate things. I don't fix the person. I'm not the, it's not the practitioner's story, right? I'm just there to shine light on the path to help you get to the highest level of functional independence to get you to be able to move as efficiently, as safely as you can.
Ladies and gentlemen, tonight I'm talking to Joshua Arellano, who's a judo black belt, a jiu-jitsu brown belt, a full-time physiotherapist, and has done a ton of work with combat athletes. So my very first question for you, Joshua, is it seems to me that of all the combat sports that I've ever trained in, if you leave out brain trauma or and concussive damage, that judo is the hardest combat sport on the body. It just seems like it beats the crap out of people, and that old judoka are some of the most broken up people in the world. Is this just my experience, or do you think that there's another combat sport that's worse? Or how does judo relate to, say, jiu-jitsu for the amount of damage that it does to the body?
I think that's a pretty fair assessment. If you look at the way the sports are set up, they're, they're relatively the same, but the goals are quite different. So we're using different energy sources for both sports. Whereas with judo, your goal is to score by throwing your opponent with a high amplitude throw. So basically, like, the harder, bigger the throw, the better chance you have of winning the match. So, your match will end if you go from feet to back. Then you get ippon, match is over. With jiu-jitsu, a takedown doesn't necessarily end the match. That's basically where we're trying to get down. So now we can, start scoring points and or submit from there. So there are two different aspects to each of those sports, where jiu-jitsu, even though it's, at various levels, very high paced, it's basically like, like football and basketball, where the power dynamics are a little bit different. So with judo, it's like 3 to 10 seconds or so of really, really hard, stop, restart. And the same goes for, newaza, for work on the ground. You only get a few seconds. So that's why you'll see, if you've ever seen a judoka that's relatively new in jiu-jitsu, when they first start, your brain is so trained in, I have 5 seconds to get something done, or that's it, they're going to stand us back up. So
they have a very distinctive way of moving when they come into judo, when they make the jump from judo into jiu-jitsu. And even after they've been training for years, they still retain some of that insane level of strength and intensity. But it seems like they're not, as your analogy, it's not football. It's not go, 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 okay, and take a break. It's a very, you can almost feel right away, like, oh, you've trained judo. It's a very distinctive energy that they give off.
That's been, my personal experience too, is if you train with, someone that's not used to you training with, they'll say, oh, you have really good hips, or I could feel you have a strong base. And so there's things you develop from judo that carry over, and that never really go away. Even though I've been, doing jiu-jitsu for a long time, my style is very judo wrestling based. So I will go to, the classic osaikomi, like the classic pins, and then work from there. That's just what is ingrained in me. And then you can slowly develop that to carry over into how it works, without losing or exposing your back, things like that. So, yeah.
So that sounds to me like you're a kesugatami, like you like your kesugatami, which is like the headlock and arm control.
That's my favorite. That's my favorite.
That's an awful position to be pinned in, man. You can put so much pressure on somebody from there.
It is, and that's actually a really debatable position, because even when I was, just kind of coming up through jiu-jitsu, you have various, professors or training partners, and they're like, hey man, you shouldn't use that because you're going to expose your back. And there's a strength and weakness to every move. But if if you practice something thousands of times, you develop a pretty good system of how to best avoid vulnerabilities. And
that's like saying don't go for an armbar from the guard, because if it fails, the guy is past your legs and passes your guard, which is true. But it doesn't stop jiu-jitsu guys from going for armbars from the guard. It's true that if you really screw up on your kezugatami, the guy gets your back. But, show me, ships are safe in the harbor, but that's not what they're meant for. You'd be entirely safe if you never went to kezugatami. Well, you'd be somewhat safer if you never went to kezugatami. You'd also tap out a lot less people.
Yeah.
So, okay. So just before we get on to the sort of physio component of this, what brought you from judo to the dark side?
Injury. I think it was, I just really loved newaza. I really did. And I started judo late. I think I started when I was about 26. And, I knew I wasn't going to be able to compete at a really high level, just on the age factor. That's just a fact. Like it's, judo is an Olympic sport. And if you wanted to really excel, you got to start fairly young. And when I had first started, I really, really enjoyed the newaza aspect. And I wasn't a wrestler. I was just kind of like a wannabe football player coming up in high school. And then I powerlifted in college. So, I was just a lot bigger than I am now. And being humbled by people very smaller than you, I was just very, I kind of couldn't get enough of that part. So then I was like, there's got to be something else that I can start to study. And that's how I slowly started to learn about jiu-jitsu. And that's kind of what got me into it. And then I just kind of stuck with that, with jiu-jitsu a little more, more because of injury, kind of like the age factor and the injuries that were just kind of piling up and having to change style.
Yeah. When I think back to the people who taught me judo, they were older, and especially the older ones of the older crowd, a lot of them would do randori with like light white belts, but, standing judo sparring. But really, they just did newaza. Really, they just did groundwork. And it does seem like a significant number of older judo black belts end up gravitating towards the groundwork because they can continue going to their club, they can continue coaching, they can continue having fun, they can stay in their sport, but they're not, their shoulder they dislocated 4 times is somewhat less likely to come out on the ground than it is compared to getting thrown on it.
Yep, definitely. I mean, you can only show a sacrifice throw or a really nice uchimata for so long. Once once your body says it's kind of hard to move that way, then there's definitely newaza techniques, ground techniques are still fairly well preserved. Once you're we're advanced in age, you could still kind of move around pretty well.
So let's kind of skip through some of the more common injuries that you work with combat athletes and talk a little bit about prehabbing, rehabbing, and recovering from the injury. So what is the most common injury that you see? What are the 5 most common injuries that you see in judo and jiu-jitsu?
I would say knees, elbow, neck, and small joints. I would kind of, I'd say, knee, elbow, neck. And I mean,
I'm
any of
surprised that
the
you're not
smaller.
including shoulder, but maybe that's just in my little group of people. There've been a fair number of shoulder issues recently.
Yeah, I would think that's definitely up there too. I think the biggest ones that I see that are the most of, just me personally, are probably knee, neck, elbow, um, but definitely, I mean, definitely shoulder. Um, but which one the most? I'm not quite sure. I
For
would say
sure.
they're all relatively equal. It's shoulder is definitely up there too.
Okay. So you're saying knee. Like, what are the classic knee injuries that you see in the grappling sports?
So with me, for example, I've tore both my MCLs, and those were not from heel hooks or anything like that. Those were from throws, and so with judo, uh, you can have something that's a non-contact uh, injury that's say you're not getting the torque from a heel hook, or someone is not creating a valgus force or a varus force, meaning like inside or outside force, but you have a specific angle at your knee, and then you try to create a throw, or you are defending something, and then that's when you can create injury. So there's a when your knee is at a specific angle of flexion, and you create a moment of any kind of movement, then you have a risk of injury uh, just without any contact. When there is contact, then obviously, if you're getting hit on the outside, then that's going to stress the medial aspect of the knee. If you get hit on the inside, that's outside of the knee. And then also with torsion when you're in a heel hook or something like that. So with takedowns, so related to both judo and jiu-jitsu, with takedowns, you can see really bad knee injuries with in judo it's illegal, like kani basami,
Right.
or but you still see that in jiu-jitsu, because depending on the rule set, that's allowed. But
The flying
typically
scissors, which I once made a YouTube video called "The Most Dangerous Takedown in Judo and Jiu-Jitsu,"
yeah,
and I vote for
that's
Kani Basami, that flying side scissors, which is too bad because it's a beautiful throw when it works.
it is. And we were taught that, and I really liked it, but you have to do it correctly. Tori, the person performing it, has to do it correctly. And then obviously, your training partner has to be knowledgeable of how that throw works, so that we can decrease or mitigate the chance of injury as best we can, because there's friction plays a part too with your feet. If your feet don't move, then it's not only your knee at risk, you can injure your ankle too.
Mm-hmm.
So it's a pretty dangerous throw, but it's a beautiful technique.
Yeah. What? So, if you had to generalize, like, what? Say I'm worried about my knees. Say I tweaked my knee 5 years ago, and I want to not injure that knee again. What is sort of the best prehab or preventative measures that I could take to prevent knee injuries in the future?
The thing I always say, and not to sound like a Debbie Downer, but there in combat sports, it's not a matter of if you get injured, it's when. So you'll hear a lot the word mitigate a lot, and a lot of us physios or clinicians use that because we're trying to mitigate the uh, amount of injuries that uh, or the level of injury that occurs. You can The best way to kind of go about it, I think, is if you think of what the knee does biomechanically. It doesn't just flex and extend. Our knee is meant to rotate too. So we need to be able to access our full range of motion of flexion, extension, and rotation. So doing things that incorporate all of the range of motion of the knee and being able to control that, to have some neuromuscular control over that, as well as a very popular thing you're seeing now that it's becoming more and more exposed is learning to develop end range strength in certain joints. That's probably the most general way to say, what's the best way to quote unquote prevent injury is if you think about how we get injured or produce injury in combat sports, it's at the end range of a joint, right? So if I'm getting armbarred, my joint, it's at its end range. So there's a couple, and getting off track of joints, but the mechanism of injury of say an armbar is obviously, the force that's being produced at the joint, but it's also that forced eccentric action of getting your arm like forcefully pulled away from you. So, concentric, eccentric. So learning to develop strength, not only from your mid ranges, which, like mid range of like a bicep curl, but end ranges. So way out here, way close in here. That is probably the best bang for your buck, is learning how to do that. And that is, through intentional, slow, controlled movements, as well as developing some isometric strength as in those various ranges of motion. And that goes for pretty much every joint is learning to access the range of motion that you have available, and then strengthen that range of motion, not just in the mid range, but all throughout the entire range, especially end ranges.
Okay. Well, that's really interesting. So let's dig deeper on the knee aspect. How would you develop the strength, and you call it the neuromuscular integration of the knee joint? How would you develop the strength at the end ranges, and then the overall, was it neuromuscular integration?
Yeah, so neuromuscular control is just basically like, so without moving my camera too much, I'll show you from my shoulder, for example. So if I'm trying to access all the range of motion I have in my shoulder joint, if I just kind of, swing my arm around, I'm not using full control, muscular control of that. I'm using momentum, right? But if I'm trying to access all of that range of motion, then I have to deliberately control all of that range of motion throughout my joint's entire range. So with the knee, if we're talking not only flexion extension, but with rotation, then we can start to look at some rotational type drills where we're isolating the movement in the tibial femoral joint, so we can start to work on controlled movement of that joint in relation to the femur. So you can isolate that joint just based on how you. So if I'm sitting in a chair, I can kind of place something in between my knees and then just have a little bit of pressure to kind of lock out my femurs, and then you're essentially rotating about
your feet in and
tibia.
out.
Yeah. So that's like
Okay.
an example of how to work on neuromuscular control. So when you start to do something like that, you can experience cramping, and that's a normal sensation to experience, because that's basically your nervous system saying, hey, what the hell is going on? We're not used to that. So, it's going to be really shaky and you might cramp up. Once you start to develop some control, then that will kind of decrease, because now your brain kind of understands, oh, hey, it's safe to move in that range of motion. We got this. We can move in that way. So that's kind of the neuromuscular control part, and then isolating that movement is just a matter of positioning yourself in the right way so that you're not compensating by moving your hip in and out or something like that.
Okay. So when you're talking about developing the end range, the strength of the end range, I'm thinking just as a like leg extensions, but only doing the last couple of inches, or hamstring curls, only doing the last little movement of bringing the heel to the butt. Am I misunderstanding what you mean by strengthening the end range?
That for the most part, that's the right idea. So say we wanted to, if you were working on your hip, but you wanted to bias a muscle group more, you can add an isometric contraction of your hamstrings by flexing your knee and then moving the hip through a specific range of motion. So it's all really based on the position that you place your body in, and what your goal is as far as where exactly you need to strengthen. So, for example, if you have a knee injury, the one of the most important things we need to get back is full extension of our knee. So if we lack full extension of the knee, then that translates over into now your gait biomechanics are going to be impaired, because now your the way your heel strike or your foot contacts the ground is going to be changed, because now you are not able to fully access all the range of motion or end range of motion of your knee, and that's going to impact how much range of motion you have in your hip and your step and stride length. So if you had, for example, a knee injury and you lacked some extension, then we can work on that, getting that end range extension by doing something like a passive stretch, whether that's using gravity or something else. And we hold that passive stretch for X amount of time. So it's got to be a fairly long period of time of a passive stretch. And after that passive stretch, then we start to introduce load. And you're loading into that new, when you are performing a passive stretch, you're trying to access some range of motion in that joint. And once the nervous system kind of calms down a little bit, it kind of allows you to gain a little bit more range. Now we kind of solidify that new range with contraction, with an isometric contraction. And then you can just shift from creating that contraction to now moving yourself more, actively moving your knee into more extension. And then you contract again and move into more extension. So that's
basically PNF stretching.
It's
for back in
yes.
the day.
There's something called PNF, yes, and there's the most popular technique or methods that are coming out that you see now are like functional range conditioning, and I don't have certification in that, but I study that, and I think a lot of physios have picked up on that. But it's relative to PNF. It's just the philosophies and techniques are different, but it's relative to that. Yes.
Functional range conditioning.
Yeah, but I mean, really, everything works. It's a matter of graded exposure. So whatever technique you like or you feel is going to help you the most, it's really a matter of just graded exposure. So doing that systematically so that you're not jumping from one extreme to the next, then you are going to see some success with prehab or rehab. It's all really about graded exposure.
What do you mean by graded? Like
progressive? So if you're trying to rehab a joint, or you go from maybe really low level isometrics in the acute phase to jumping to something like a plyometric exercise, then you skipped a whole range of things that you should have focused on prior to that. So if you are training your, the tendons from one end of the spectrum, say isometrically, relatively low load, but then you start jumping into some kind of some kind of plyometric movement, that's going to be too much load for the tendon or the muscle too fast. And when we have an unprepared joint or muscle, or underprepared, that's when we are going to introduce injury. So if we do not possess the capacity for whatever load we're placing on the body, that's when we increase our chances of injury.
Okay. Well, I love how you're bringing in sort of the overall principles that are applicable to all injuries. So why don't we continue our tour of the human body? And if you can bring in more universal principles, that would be awesome. And even if we get off topic of the specific body part, I'm happy with that. I think the next thing you mentioned was the neck. And it's certainly true that a whole lot of grapplers end up with neck problems. Now, we're doing so many things with our head, like we're posting on the head, we're bridging on the head. People are putting us in neck cranks. We're getting, impact on the side of the head when we're trying to take down. What typically causes, and we're just using it all the time. So there's overuse injury potential there as well. Is there one that you see more than any of the others? Sort of what is a classic grappling neck injury that you see?
That is the neck is something I really like to specialize in, because that is a personal journey of mine, and that's why I'm not medically cleared to compete anymore because of neck injuries. So mine, without turning this into my story, I had an injury early in judo with a disc herniation, and it was from training. And we were just relatively inexperienced, and I don't remember the exact position, but I may have been in some type of kind of like a front headlock thing, and then I fell on my butt, and then I just remember feeling this jolt of electricity, and that was when I had first started. So I had a disc herniation injury early on. And then I had a couple other neck injuries from both judo and jiu-jitsu. And then the big one was around 2018. I think I was training for Worlds then, and I had such bad pain in my neck, and it wasn't even from a big move. It was just we were working on some positional things, but my chest was pinned, and then my neck was moved into its a range of motion I didn't have access to, and that's where I had the neck injury. So from that, I found after trying to just calm things down and be as conservative as possible, it just wasn't getting better. And so I had to have some imaging studies done to figure out, hey, what could be contributing to this. So that there are several things that it's not just a disc related thing that can cause neck issues. So we can also have something called stenosis, which is basically like an arthritis in our joint, and that could be on the outer portions of the joint or inside the the vertebral canal itself, where the spinal cord runs through. So with me, for example, I have something called congenital stenosis, which just means I was born with a smaller vertebral canal than the average person. So over time, with micro injuries or big injuries, we can develop osteophytes or bone spurs, and then those things press on either the spinal cord itself or the nerves that are coming off the spinal cord, and then that's when you can see arm weakness and things like that, and that can potentially be very dangerous. So with the neck, in grappling, yeah, you're right. It's that our head and our hands are like our first, that's like your line of defense, right? And we're always kind of in this position. Everything is, my style too is I have a big ass head, so I'm always using my head, whether I'm posting or putting it on your chest. I'm always fighting with my head and my hands. So just those little impacts and moves can kind of add up, and then we can have injury from being cranked or posting on your head or things like that. So we can have issues from the disc, from ligament damage in the neck, or from trauma to the spine itself, and then you develop things like the bone spur thing. So anything that is creating or contributing to inflammation or causing there to be less room for the spinal cord or the nerves coming off the spinal cord, that's when you're going to experience all the issues with like radiculopathy or muscle weakness, things like that.
So how much of a fan are you of neck strengthening?
That should be a non-negotiable with any grappler that is looking to mitigate injury risk. Is the techniques or things that you see, or some old school stuff that you see, like very classic things, or like neck bridging, things like that. That's a pretty that's a debatable sort of exercise. And while there's no bad exercise, there's no bad movement, but it's a matter of, do you have the capacity to do it, and at what point in time are you doing this movement? So if you just take the average practitioner and you start having them neck bridge and roll back and forth and creating that axial load on their neck, they are not conditioned to, their neck does not have the capacity to tolerate that. And so even though you're trying to strengthen something by doing a movement that you see or that has classically been done for strengthening, it may not be the best way to do it based on what level you are or your level of experience. So approaching that in a more educated way is definitely something that every grappler, every fighter for that matter should focus on, and not so much for the strengthening to prevent the concussion. That's a debatable issue too, and it does allow for voluntary control. So, if I'm getting popped in the head or something, I have some voluntary control of muscle strength. But, if you get hit with the blow that you can't see, that's not necessary. That it's a different, it's, does that carry over directly to that? I'm not sure. So, in terms of,
I have to agree with your assessment about bridging, because I bridged for years, the classic forwards and backwards wrestling bridges. And I found that the more I did it, then I ended up some neck pain from, tapping out too late to neck cranks and landing on my head a few times during takedowns. And after that point, the more bridging I did, the worse my neck felt, not the better. And there was a guy years ago I wonder if he still has any disciples left. Matt Fury, who literally claimed in his infomercials that the ghost of American catch wrestlers had appeared to him in his dream and had taught him the secret moves of catch wrestler Farmer Burns. And he had this like one size fits all. The way to cure all neck pain is by bridging. And I'm here to tell you, and I think you're here to tell me that if you're doing an exercise to strengthen a body part and it makes the pain worse, stop. There's something wrong. And when I stopped neck bridging and started inserting other neck strengthening exercises, typically ones where I didn't take it through as great a range of motion, especially when loaded, to maybe put less wear and tear on the discs. I don't know the exact mechanism, but certainly more isometric type strengthening in different angles. I could do quite a bit of that without creating neck pain, but man, I went through it was 2 years of denial of bridging and man, my neck hurts. I need to do more bridging. No, I didn't need to do more bridging. I needed to stop doing the bridging. And, doctor, it hurts when I do this. Well, stop doing that and do something different.
Yeah. So I always say, that's kind of an inside physio joke too, we'll stop doing it. What the correct answer should be is modify it. Right. So I try to prevent from saying, well, just stop doing that. Let's modify it. Let's make this, more applicable in some way, just by modifying the movement. And when in our neck, we don't just have just the big sternocleidomastoid muscles. That's those are the muscles that typically get the most hypertrophy. But learning to develop the deep cervical flexor muscles, and you've probably seen little chin tuck exercises, things like that, that really helps, because those are the stabilizing muscles. So we need a combination of our big muscles and also the stabilizing muscles need to be strong as well. So, in itself, neck bridging isn't bad. It's just, there needs to be some context. When is this the right time to do, and at what level is the athlete or practitioner, and what is their competency with this movement too. So me personally, I would lean more towards less axial load, which means just through the top of your head, less load from gravity or pushing force, and more loading through a linear range of motion, or just changing the force vector a little bit. And I'm sure you've seen, there's a whole bunch of different neck devices, and one is not better than the other. It's just a matter of preference. And like I said earlier, everything works. It's just a matter of, progressive overload and graded exposure. You just got to go about strengthening the right way. With an acute neck injury, or even a chronic injury, one of the best ways and one of the best exercises or movements in general that I love for everything is isometrics. So we can use isometrics for strengthening, for pain mitigation, and just to start to develop just neuromuscular control of certain ranges of motion. So learning some basic isometric strengthening, then holding that isometric contraction through certain ranges of motion, and then just progressing from there into higher velocity movement patterns. So, there's things like, the iron neck. There's a new, relatively new device that I've seen. I can't remember off the top of my head, where there's a kind of resistance band, and you're laying you supine on it, and you can rotate with resistance while you're kind of on your back. So there's a whole bunch of different tools, and really you don't really, do you need those? No, you can use resistant bands, you can use a ball, you can use your hand, you can use a partner that that's probably the most ideal is you can, just use your training partner, and then you graded exposure, for example, would be like if I was trying to create an isometric contraction with my neck muscles anteriorly, then I can use, I could put a pretty good amount of force into my hand. Well, to ramp that up, then you can have your training partner kind of use them as a post and their hands, and then based on how you position or angle your body, then you're increasing the load that way. So there's a whole array of techniques that you can use for neck strengthening. But the one that I personally like to use a lot is the iron neck, and it's not a perfect device, but for what it is, I really like it, and it allows you, a lot of movement and a lot of creativity with different movement patterns. So if we're, working on changing levels but trying to keep stability, you can hook that thing up to, resistance bands or a cable machine, and work from there. So you can stay relatively isometric, or you can add rotation at various angles, and you can do that with other things as well. But
I have an iron neck, and I use that, and I use a neck harness. And about half the time that I use the neck harness, I go through a range of motion, typically for the back of the neck. But you can also use it isometrically. Like you can hang weight off of it and bend over and kind of swing the weight. So it's like the trunk of an elephant moving in front of you. But your head's job and your neck's job is just to stabilize it while this weight is shifting, like somebody's trying to pull your head, I don't know, in some guard position or standing. And your job is to not let your posture get broken. Your job is not to, end up with your ear near your shoulder or your head twisted, because you're not strong when you're in that position.
Yep. And I think that, that's a valid exercise too. It's more about the amount of load, right? So if we're hanging a 50-pound weight off our neck and you're like, oh, then you're kind of effed up a long time ago.
I had a woman come up to me at the gym once when I worked out at a public gym. I mean, I've got a home gym now, which is fantastic, but this is maybe 10 years ago. I was doing, I think, 2 35-pound plates with a neck harness, and had a very kind, well-meaning older woman come and beg me to stop. But it made my neck feel good in a way that 70-pound neck extensions made me feel better than bridging. So I'm pretty sure I could have beat her at jiu-jitsu too. So I'm not going to take her advice.
Never take advice from someone that can't beat you at jiu-jitsu.
Yeah, that would be a terrible heuristic. That would be the death of expertise amplified to the 1,000th degree. Well, this I don't know. This oncologist is telling me that I've got stage 3 liver cancer. I need to do this, but man, I choked him out, and he didn't know the first escape. So I'm not going to listen to him, and I'm just going to listen to this conspiracy guy who's pretty good on jiu-jitsu on Instagram. Ask him.
Yeah, I'm sure we
be careful of what you ask for there, Joshua.
Yeah. I'm not gonna. I won't open that can of worms. Yeah.
Elbows. So I've seen everything. Elbows from tweaked biceps to full dislocations, which are pretty gross. What is a typical elbow injury that you see?
Yeah, so the most obvious is from an armbar, and that's hyperextension of the elbow joint, and the ligament that gets stressed the most is the MCL, the medial collateral ligament. So that's the medial is on the inside of your arm. So that's where we see the injury occur the most. And then, the mechanism of injury again is like that forced eccentric contraction. So you not only have potential to injure the joint capsule or the ligaments, but there's also muscular injury as well. And so with an armbar, the concept of kind of end range control, or eccentric control is an important element to integrate into either rehab or prehab. So I think understanding the mechanism of injury and where you are either in prehab or rehab, that will kind of dictate your success in improving strength or your ability for that area to heal.
So on behalf of people who've been watching MMA for more than 25 years, I forget which UFC it was in, but somebody caught somebody in an armbar. I should know who this was, and I could do some research to figure out who it was. And the commentators were like, "He's popped the capsule!" Popping the capsule became kind of it was an early meme of jiu-jitsu. So if you put me in the armbar from hell and I don't tap, and my arm goes beyond 180 degrees, goes to, I don't know, 190, 195 degrees, have you actually popped the capsule, and what does popping the capsule actually mean?
Yeah, so the joint, our joints have a joint capsule. So that's just where everything kind of lives within, right? So yeah, you can damage the joint capsule, or if you're,
So that's the connective tissue that's around the fluid in the joint?
Yeah. So I'm trying to think of a good way to explain it. So like with your hip or your shoulder, you have if you have like a ball and socket joint, there's a capsule that surrounds that, right? So that's where everything is just held together. So we don't just have the bone connecting to the bone that's held by ligaments and tendon. Like there's an actual joint capsule that keeps everything. So if you feel like if you were distracting the joint or kind of like pulling it and it kind of gets sucked back in with that like negative pressure, that's happening within the joint capsule. So there's when you have an injury to a joint, there's more than just injury to a ligament or a muscle. So when you have an injury in your knee, like there isn't just the ACL that gets injured. You can injure the meniscus, you can injure the MCL. So there's a whole bunch of surrounding anatomy. So with the elbow, you have like the anterior capsule, posterior capsule, and then you have like the radial collateral ligament, which kind of goes around one of the bones in your forearm, and then you have annular ligament. So there's a whole bunch of without getting too nerdy on anatomy, there's a whole bunch of things. But yes, you can definitely injure, disrupt the capsule. That's basically just what keeps everything kind of in place.
Okay. So the classic remedy at your average judo club or your average jiu-jitsu club is if you get your elbow hyperextended, the coach runs over and puts some ice on it, which brings me to something else I wanted to ask you about. So for years and years and years and years, the classic remedy for strains and sprains has been RICE, which is rest, ice, compression, and elevation. And in the last couple of years, supposedly the person who came up with that acronym has turned around and said, ice is a terrible thing. Let's, we should get rid of the RICE idea, and that ice and cold slows down healing. I hope I have that complaint correctly expressed. So what do you think about using cold or rest, ice, compression, elevation, but specifically the ice in the treatment of injuries, especially if they're new?
So with ice, that's how it started, was RICE, right? RICE, rest, ice, compression, elevation. Then it kind of changed to PRICE, which was protection, rest, ice, compression, elevation. And then another one that came out was police, which is gosh, and now I'm going to have a brain fart and can't remember, but uh, protection, optimal loading, compression, elevation. We can definitely. I don't say don't take ice out, take that out completely. It definitely can hamper tissue healing. So the natural response for our body when we have injury is inflammation. That's when all the cells come to start doing their work to clean everything up and to start the healing process. The problem is if there's too much inflammation too fast. So with ice, I would say, if we're in a significant amount of pain, it hurts like hell. There's nothing available. I can't if you have a bad injury, we can't kind of stabilize it, anything like that. But we have ice. Sure, throw some ice on there just because it's the cheapest pain modality that we have. As far as like in terms of rehab, that's right. It's not ice is not the number one go-to thing when you have an injury. The best thing you can do is say, for example, a sprain or an ankle sprain is early movement. So just basic early movement just to help to start to stimulate the lymphatic system and start to kind of drain out the waste production that's occurring during tissue healing. Early movement is going to be your best bet. So typically what I will recommend, just generally speaking, so if we have like a relatively low grade ankle sprain, I would not say, oh, you need to rest that and elevate it and ice it several times a day for 15 minutes. Then that's when you're getting into trouble, because number one, you are not, to step back a little bit. So when we have an injury, what happens is the body your brain kind of locks up that joint, or tells the muscles, hey, just lock up because we're hurt. So we don't want to move that joint. So you're going to have, some spasmy muscles or very hypertonic or feeling the sensation of very tight or stiff muscles. And it's, a protective mechanism. Our brain's trying to protect our joint. So if we say, don't move it, just throw ice on it. Well, right there, you're starting to put yourself in a bad spot, because now it's going to be more difficult to initiate movement. And then if we're adding too much ice to that area, then we really are slowing down the inflammation response, which is how our body naturally heals. So I don't say, don't take out the ice. It's just when you use it and how you use it. There's other techniques you can use with ice, like contrast heat and ice, and that can help with circulation. But I think for the most part, protecting the joint and then adding some sort of compression, whether that's with either an ace wrap or a sleeve of some type, not necessarily like a restrictive brace, but something that adds some compression, and then early movement. So that could be just basic range of motion or just some kind of submaximal isometrics, because again, going back to what we said earlier, isometrics can help to mitigate pain. That's kind of the most ideal way to start to deal with an acute injury of that type.
Yeah, I know with my hip replacement, which was about a year ago this week, I think, I did use ice, but it was really only when I had overdone it physically. Like I was walking, I within, I want to say 5 or 6 days, I was, doing a couple kilometers a day walking, and walking just being the universal cure for all lower body injuries. How's that for a big statement? It's what
Yeah,
I've always used. And like, oh my
that's
God, I'm in a
that's
ton of
actually
pain now. Let's ice it a little bit to just,
that.
I was trying to avoid the opiates. I was trying to avoid all the painkillers. So I
Yeah,
was going to the ice.
that's a pretty. That's a for patients that I've seen. That's a pretty classic presentation of how they're managing like some of their rehab processes. Well, I know I can walk, so the surgeon wants me to walk, so that's definitely good, because there's something called mechanotransduction, or we need to be able to stimulate the mechanoreceptors in our joints. So when we have when there's new hardware in there, we've got to kind of rewire our brain to say like, okay, how do we put our proprioception is thrown off, and that's just basically where your body is, where a limb is in space, or where your body is in space. So whenever you have a surgery or something that invasive, like a joint replacement, your body has to kind of recalibrate itself. And so, yeah, walking is great, because we're loading the joint, you're getting your gait biomechanics kind of back online. But definitely, when with my patients too, I still have them use ice during post surgery.
I mean, that's a
I
pretty big trauma, all things considered. I mean,
Yes,
you're going to
yeah, I
get tons
mean,
of inflammation no matter what.
yeah, I mean, you're opening up the tissue, and then that it's a really invasive thing. So anyone that hasn't seen or watched a surgery, I would recommend like checking that out on YouTube, because it's pretty amazing what how your body heals from something like that.
I'll say going into the surgery, the operating room was a little bit of a mind fuck, because you walk in there and it's okay, the standard bed, and there's the anesthesiologist, and there are the nurses, and that's all, there are the big lights, and that's all kind of normal. But for an orthopedic operation, all around the outside of the room, like 20 feet of table, is just covered in tools. It looks like, I don't know, you've gone into a garage, except everything
Yep.
is stainless steel. Everything is bright, shiny, and you're like, there's 12 hammers, there's 13 spanners, there's wrenches, there's these silver metal things that I don't know what they do, and that's kind of a little bit intimidating. Like, wow, that's a lot of tools. I guess they just have to be ready for anything and any body size. But yeah, it's I come away with a sense that it's 8 parts carpentry and 2 parts medicine.
Yeah, yeah, it definitely is. You As far as the rehab process of something like that with the hip, then yes, I still recommend using ice, but it's a matter of how much ice you're doing, and when you're doing it. It's not a bad thing, but it definitely can help. And then walking, yes, walking obviously helps for reasons I explained, but then we need to look at, for example, someone that is still wanting to do grappling or jiu-jitsu. Now we have to look at, okay, is our hip stable enough to do this now? So that is when, we have to, that is when someone like me that specializes in grappling really plays an important part with collaborating with the patient and the surgeon, because now we're like, I speak both languages, right? So now I can advocate for my patient and say, hey, this is their goals, this is what they want to do, and then I can speak more medical terminology, blah blah blah, with the physician, and then be able to translate that back to the patient. So it puts me in a good position, because I can kind of relay back and forth between the surgeon and the patient and say, okay, this is the expectation of the surgeon, and this is my patient's goals. This is what they would like to be able to do. And then, once you have the green light from the surgeon, they say, okay, we're stable enough at this point. Now we can start training. Now that is important because, walking, isn't, while it does help, it's not going to be the most ideal for your development to return back to what you're doing. Because realistically, like, yeah, you have a whole brand new joint. Like, you'll have, more range of motion than you did previous to that. But it's now we have to be very careful with end range movement. So even though, you have a new joint, now we got to be careful with, okay, how much hip flexion is actually going to be okay? How much can I actually rotate my hip that's going to be okay? So that's where, the having a clinician that understands the sport, understands the surgical procedure itself, and then the rehab aspect of it. That's where, clinicians like myself can really shine when you speak the patient's language of whatever sport or whatever it is they're doing. That is, I'm really glad to see a lot of not just physical therapists, but, like physicians or chiropractors or athletic trainers that are specializing in certain sports, especially grappling. Now you're seeing a lot of physios too that are specializing in the sport, and that's great because the more of us, the better. There's only a few of us, that you develop slower. But when you see guys doing new stuff, then you learn from that, and you're like, oh wow, I didn't even think of that. So.
Yeah, I think I did a pretty good job of rehabbing that injury or that surgery. I think I did walking and then unilateral leg movements, then the big movements like squat and deadlift, and then hiking on unstable terrain, and then a gradual slow return to grappling. But all that being said, I think if I had consulted with you, I could have saved myself a couple of scares on the mat and maybe done that process safely. So for my next major joint replacement, whatever that is, I'll talk to you before getting back on the mat.
Yeah, definitely. And it's never, and it's not like it's too late to start doing that now, right? We can still modify what you're doing now to where it's like, okay, well, this is what I did, this is where I'm at now, but now it's like, okay, my job is how can I help you, not make you, how can I help you move better? That's my main job. I just facilitate things. I don't fix the person. I'm not the. It's not the practitioner's story, right? I'm just there to shine light on the path to help you get to the highest level of functional independence to get you to be able to move as efficiently, as safely as you can. So there's always room for improvement. There's
For sure.
always you can always improve on your whether it's your strength and conditioning or just general strengthening or health and wellness.
I would definitely agree. Let's talk shoulders a little bit. They're really bloody, tricky joints, and they're not. I mean, they move in so many different directions, and there's so many ways you can screw them up. What what's the most common shoulder injury that you see, and what should how can we be prehabbing and preventing those injuries?
Yeah, so the shoulder is probably like the most complex joint because it's our hip is a little bit more stable just from anatomically speaking. The shoulder it moves in more directions than any of our joints just based on the type of joint that it is. So there's so many different types of injuries that can occur from that, whether it's a tendinopathy or a ligament uh, um, damage, or if when someone says they tore their rotator cuff, then we have the insertion of the tendons from those muscles in the shoulder joint. Those are injured, or we can have injury to the labrum itself, just like in your hip. So whenever we have like dislocation type injuries, then that can injure the ligaments and tendons, but it can also injure you can have injury to the labrum itself. So there's the more complicated the joint, there's a lot more injuries can occur. And so with submissions, we're getting taken to end range mostly with we excuse me, you see a lot more internal rotation injuries as opposed to like external rotation, because a
So
key lock
Kimuras
or
and
an American.
omoplatas rather than Americanas.
Yeah, and that's just because with Americanas, once you get up to higher levels, you learn to defend those a little better, right? And they're a little bit harder to the nuanced movements are a little bit harder to dial in to get it just right, unless like you're a really good specialist at that and you could just nail those out. We don't see it as often with a Kimura or something like that. That can happen from a whole bunch of different positions of you can place your opponent in. So internal rotation is probably where you see the injury the most, as far as like a submission standpoint. But then we also have injury to the shoulder from if we're speaking just specifically grappling, just from a foosh injury, so fall on outstretched hand. So then that's when we can have fractures and then anterior or posterior dislocations. And that can be, the best way to try and mitigate that is to learn how to fall. So that's what I always, I put that, all over my Instagram is everyone should learn how to fall. I don't care who it is. So even my, the patients that I see that are, my senior patients, I will teach them something, whether it's on their couch or on their bed, and just teach them basic fall techniques, because sometimes with that population, sometimes it's not fall prevention. It then becomes kind of fall recovery, and how you deal with, oh shit, I'm falling. So learning how to fall, it goes from being a little kid all the way up until where it's really important, to where now we're at the geriatric stage. Like, you fall down, now it's kind of life or death. You break a hip, or that's the falling is the number one uh, major cause of injury for elderly population. So speaking with athletes, still learning how to fall correctly can prevent or mitigate a lot of that injury. It still hurts and you could still injure yourself, but at least it cuts that risk down of some really catastrophic injuries.
Yeah. I mean, the judo people are obviously good at falling, and skateboarders are really good at falling. So maybe we should give geriatric patients a choice. You can either start judo or you can start skateboarding. And
Yeah, that's been a really interesting thing, is like is how do we kind of ethically get this into practice, right? So you have to be able to develop some clinical studies that can actually look at stuff like this, but then it's like, how can we safely do this? So we can't just get a whole study of elderly people and just be like, there's a crash pad, I'm going to push your ass on it, and,
yeah,
and
that's the
good
control
luck.
group. The
So
control group is no
yeah,
training, just push them over. And then
so so there has been some studies that are coming out that deal with that, and how can we incorporate this into fall prevention or fall recovery training. So yeah, learning to fall it carries over into so many things. So it's a whenever I have someone that when I get asked, hey, can you start to teach me some things? That's the first thing that I ask is, hey, do you feel comfortable falling? Do you know how to fall? And if they can't, then, I don't feel comfortable teaching you something until you at least have some basic knowledge of falling, because that's going to happen. Whether you're, in a real fight or just learning for fun, like, you got to learn how to fall. You've got to learn that first.
So I think we've come to our final body part, and that's the small joints. And, clearly this is an issue, because if you take a look at some judo black belts and some jiu-jitsu black belts, they spend half an hour and probably $10 taping up their fingers and taping their wrists and taping their ankles and taping their toes before they ever step onto the mat. I mean, you can't wear wrestling boots in judo, but there is no limitation to how much tape you can put on your foot. So I've seen, people basically just entomb their entire foot. They might as well have made like little laces out of the tape to make it look like a wrestling boot. So clearly these are common injuries. My standard advice for like, hey, my fingers really hurt when I do jiu-jitsu is twofold. It's like, stop doing spider guard or De La Riva guard, where you're just hanging on for dear life onto the gi, and then do more no gi. But obviously in judo, you don't have an issue, or you don't have that as an option. And so much of judo nowadays is grip fighting. I mean, the forces put on the poor fingers in judo, it really must be a survival of the fittest. Like, either you have iron fingers and you stay in the sport, or you have normal human fingers and you're going to blow them all off and you're going to move on to another sport.
Really, it's you don't see normal. I haven't been doing any grappling like consistently, and you have you can have nodes, like development, like Bouchard's nodes, or nodes, or the little bumpy judo fingers you get. They start to become crooked, and you hear all that popping and crepitus. And if you look at the Olympic judokas, or any of the high level judokas, like they just look like their hands are just mangled. And you're right. You can't, with judo anyway. Hand fighting is super important, and you got to be able to grab the material. So one way to kind of mitigate that is just learning different grips, right? So if we're grabbing so much this way and then getting the material yanked, that's when we're creating a lot of trauma there. So learning different grabs, or grabbing the material a little differently, can at least kind of mitigate that a little bit.
So it distributes the wear and tear over different fingers and different angles.
Yeah. So if I'm, I don't have anything right here to grab, but for example, like spider guard, if we're in jiu-jitsu, you're really using, grips sort of like this, and that's a lot of stress on the smaller parts of the joint. Whereas if you change your grip and grab more of the material, whether it's lapel, or you're grabbing more of the sleeve,
like a pistol grip, as opposed to the fingers curling in grip.
Then that is that's one way to kind of give these the more distal joints a break there. And the other thing too is with judo, when we're throwing, we're not necessarily, like, you're not grabbing on for dear life like this. When we're creating, when we are trying to move our trained partner or our opponent, your grip's mostly like down here. So when we're moving, it's more like, it's more here than this. So I'm not trying to grab the material sort of in this sort of way. So we're kind of grabbing more down here. So I have more control of where I'm trying to like create kazushi, or trying to move my training partner or my opponent. So definitely working on just changing grips with as best you can is one way to, especially like if you really have some joint inflammation, then it's like, okay, now you really should work on just changing the grips, because that's if you can't we don't want to stop completely. We just got to modify it. So changing the grips. And then, with tape, I use a lot of tape. And it's not really going to prevent injury, but it does help to give you a little extra layer of support or bracing. And it also so for example, if we tape our fingers, just doing a basic tape pattern. So if we do, if you do a little X pattern and then anchor that X pattern, then, we don't, the more intricate the tape technique is, the less, realistically, is that going to stay on? Nope. That the second you start grip fighting and going all about that, it starts getting in the way. So what I usually recommend is just a super basic tape technique where, you're creating kind of an X to whatever part of the joint you're trying to limit, whether, it's kind of varus valgus or we're trying to limit like hyperextension, just creating a little X pattern and then securing that with some anchor. Then that will give you, then we don't have so many different patterns and tape rolling and things like that. So even worst case scenario is just going in like a circular pattern, because then you're still limiting you're not, when you have tape on your fingers, you don't have that full range of motion. And that can be a good thing, because you're not allowing yourself to get into, super, tight little positions with the gi material or things like that. So it gives you a little bit of protection just by restricting the joint movement, and keeping it as basic as possible is probably your best bet, because then you can reproduce that. If you really got to do it real quick and retape it, then you can just throw that same pattern on and go.
I'll put a link into that basic X pattern either in the people are getting this in audio format down the notes on their podcast player on Grapple Arts for the page for this interview, and on the YouTube I'll put a link in right around here, and so people can see at least one simple way of taping fingers. Okay, so if people in the combat sports want to work with you, it's obviously a lot easier to do if you're in LA, if they're in LA, because that's where you are. How do people get in touch with you?
Yeah, so I also see, I also work virtually, so I do online, whether it's consulting. I was just having a conversation with another physio today, where I kind of specialize is more on the injury side of things, or working with acute or chronic. I do program some strength and conditioning things, but I tend to refer out when when there's need for, when you have the access to whether it's a field or various different various equipment that one might need. I tend to focus on, okay, what do we have available? Where are we at in either rehab or prehab? So I do things online as well. But typically, the best way to reach me is through Instagram. That's the number one way to contact me. And I have a link you can contact me through my website as well. That's linked on my Instagram, but Instagram is the best way to get in touch with me.
Okay. What would be your Instagram again, Joshua?
My Instagram is Judo Physio.
Okay. And your website?
My website is judophysiopt.com.
So Judo Physiotherapist.
So I believe it's judophysiopt.com.
Okay. Well, thank you so much. I mean, injuries are the great bane of the martial arts. There, as I said, for every one superstar grappler that we see at Abu Dhabi or the World Championships, there were 10 people who were just as good, and 10 people who trained just as hard, and 10 people who were just as talented. And somewhere along the line, they got injured and couldn't continue and couldn't take advantage of their natural gifts and their determination. And that's why we've never heard of them. It's a survivor bias. And even the very best guys in the world are dealing with injuries. So unfortunately, the sad truth is that by the time you get to be a black belt in jiu-jitsu, you will probably be like a purple belt in rehab, because
Right.
you're going to have to have done it on yourself and try to limp along as best you can.
Right. There's no everyone that is either training or competing. It's more about learning to work around what's going on with your body. It's just, that's the game we're playing. It's a martial art. We're trying to break things or trying to injure our opponent, our training partner, as little as possible with our training partner. But that's the name of the game, right? So it's number one is kind of learning to move or train around what you have going on, and then systematically approaching how do we rehab or prehab this most effectively and efficiently and safely.
Okay. All right. Well, thank you so much.
Best
of luck with your training, and best of luck with your practice.
Thank you very much. Thanks for having me. I appreciate it.